So we're going to look at a massage tutorial for the adductors. There's various ways that we can treat this group, but we're going to look at the sideline position for this. What we're doing here is elevating the upper leg with a bolster, and that leaves the lower leg, the medial aspect, for us to treat the adductors. So first thing that we need to do is get the towel on point. So we're going to tuck just into the pant line back here, just to give us a nice secure boundary. The other part we're just going to bring down here and tuck underneath the leg, so that is giving us a clear boundary line that we know that we're not going to go past with the treatment. Let's bring this leg just out a little bit straighter, so now we've got full access to everything there, from sartorius around to the hamstrings to the medial compartment in the adductors. So just be careful here, we have got a lot of muscle mass to put some pressure down into, so it will be able to take comparatively more pressure than something like the lateral aspect or the IT band, but it can be quite sensitive, especially as we get closer into the groin. And on that note, we're going to use that towel as a boundary and make sure the fingers come away to the posterior side, not around to the front, because we can't see what they're doing there. So as with any other massage technique, we're going to start with superficial effleurage. Bit of variety in the stroke. The quicker we go, the lighter we're going to go. As we start to go deeper, we slow down, just making sure that we give that feel of one continuous stroke, and we're not ever fully removing our hand from the skin. So now that the wax is on there, we've warmed the tissues, got a feel for what's going on. Let's see if we can get a bit deeper. So we can go with knuckles. Knuckles are always a good option, right arm in this case, because when we get to the end of our stroke, we're just going to run into glute. So we can't take our fingers anywhere that they shouldn't be going, and we can just work slightly more posterior with each stroke, with the bony prominence of the ischial tuberosity being the end of that stroke, which is of course the origin of the hamstrings, just around there. Make sure you break up those deeper strokes with some effleurage. We can move into some petrissage there as well. We're never going to get particularly deep, powerful strokes in the form of petrissage, but it does give us some variety, so we can use it to break up those deeper strokes. So can we do an elbow on this area? My answer is yes. We just need to make sure that we're in control of it. So I'm going to place this hand down here on the couch and slowly lower my body weight down into the adductors. So this really shouldn't be an overwhelmingly painful deep stroke. This is really just making my job easier, and I'm having to work less hard to achieve the depth of pressure that we're looking to be effective. Maybe not so much with elbows, but when you're working with fingers, thumbs, hands, try and differentiate one muscle group from the other. We are trying to focus on the adductors, but you will get some sartorius around to the anterior side, and a little bit of vastus medialis there. Likewise, posteriorly, we're going to get some of the semi-muscles, semi-membranosus, semi-tendinosus, but the focus is the adductors. So we can get up into the proximal adductor tendon, and that originates from the pubis. So for obvious reasons, we're not going to go quite that far, but we can follow that tendon up as far as we can see the towel, and then pull back, which gives us a petrissage effect. And don't forget, further down the leg as well, we've got the medial femoral condyle just here, and tibial condyle. We can bring some joint polishing in there as well. So no deep pressure down there, but certainly don't end the stroke when you get to those bony parts. Keep it nice and light, and we call that joint polishing. So that's a massage tutorial for the adductor group.